Our first speaker is Dr. Sudha Rajan, President of VYASA Houston. We'll be speaking on yoga therapy for diabetes, and will give us an understanding for both the Allopathic and Ayurvedic Yogic preservative. She will discuss connecting yogic principles and practices toward prevention and cure of this dreaded disease. Please help me welcome her.
Thank you, Asta, and thank you everyone for coming and listening. My talk is on diabetes. I would rather call it diabosity because obesity is such a big part of this dreaded disease. I call it the Ashtavakra Vyadhi, as it has, among many other mechanisms of causation, 8 defects which are extremely important to understand at the cell level, at the physiological level. How do I turn the slides? Next, okay. Yeah. No. So nearly 350 million people in the world have this disease, probably making it the definition of pandemic. And India is at the forefront of this pandemic, taking the leading place, like Dr. Nagaratna was saying, by 2020, the first nation with the most diabetics. And this country, USA, is not lagging behind too far. So these are the criteria for diabetes and the new emerging patterns. We always say patients didn't read the medical books before they came to the doctor. So they all come in shades of gray. If you just go by the book as to these are the criteria, you'll miss a lot of the in-between ones. That's why we say type 1, type 2, type 1.5, 2.5. There are lots of in-betweens. I've seen this in my own practice. And you can see the criteria very clearly: gestational diabetes, normal, pre-diabetes, and diabetes. Metabolic syndrome, if you come to any gathering in a room, you probably can find anywhere from 20 to 50% of people with some signs of this metabolic syndrome, which is a precursor for diabetes. And the criteria are very simple: waist circumference, which again goes to the abdominal or the central obesity, blood pressure, fasting glucose, triglycerides, and HDL. Many times patients say, I'm only borderline, I'm fine. You know, many things are borderline, right? You're not normal, you're not abnormal, but you're in between. But these borderline numbers are not as benign as we think. Many people with borderline numbers already have complications. It's just unknown. It's like the tip of the iceberg. Only 10% is seen, 90% is invisible. So, glucose is the driving force for the cell engine to function. And insulin is like the doorkeeper that lets the glucose enter the peripheral cell. So the conversion of glucose to energy can happen. And once we eat, the digest all the complex proteins, carbohydrates, fats, they all finally become some form of sugar, and this glucose in the circulation has to be kept at a narrow range of somewhere between, say, 65 to 140 at any time. So let's say 70 to 140. And this narrow range is kept because all the cells depend on the glucose for their cellular function, especially the brain. The brain cannot be without sugar at any point of time. So this balance is kept by 2 sets of hormones in the body. One set is the insulin, which everybody knows, but new research has found in the last 5 to 10 years hormones called incretins, and then dopamine is also one of the And you can add another one on this slide. I didn't have time to add. It's called amylin. And on the other side of the equation, things that raise the sugar are the adrenaline, the glucagon, cortisol, and thyroxine. So it's a balance. So diabetes is a multifactorial disease. Heredity is a very important part of it. But heredity can be like an unopened page of a book, right? Heredity is not like a stamp that you're born in this world to suffer with diabetes just because your parents and grandparents had it. It could be a dormant genetic factor. It's like an unopened page of a book. If you didn't open that page, you'll never know what is there. So bad things can be unopened. It's a gift you reject. Your parents and grandparents gave it to you, but you say, no, thank you. I will do my own part and not manifest what you gave me. So twins, if one has type 2 diabetes, nearly almost 100% the other twin might have it. It's pretty high. And obesity, as you can see, little kids with obesity, the president's wife, Michelle Obama, has taken up as a theme to prevent childhood obesity. Because childhood obesity, like one of the speakers was saying, if a youth is dysfunctional, it costs the nation $4 million minimum for a lifetime. I don't know what the cost is of an obese child. It's probably very similar. Obese children tend to drain the medical system because they need so much. One of the predictions, one of my statistical friends was telling me that if you look at the pattern of disease in this country, if we don't do anything, we'll run out of dialysis machines for people with kidney failure very soon. It's a simple factor that you cannot keep demanding on a system. You know, if the demand is so high, the supply has to run out at some time. So we better take care at the prevention side. So I told you about the 8 defects, the Ashtavakra Vyadhi. First, we are going to concentrate on the first 3 defects, which are well known over time for, millions of years. First is the pancreas, and my pancreas has decided to be invisible today. I don't know why. Can somebody bring up the pancreas? IT people? Anyway, that's okay. Next, okay. So pancreas, liver, and muscle, if you understand these 3 things, these are primary, okay? So the pancreas is impaired insulin secretion. This is not very well understood by patients. My patients come in and tell me, we measure insulin in all people. Unlike, in many of the regular workup, we measure their insulin level, and I say, you have very high insulin level. Then they say, how come I'm diabetic? A good number of type 2 diabetics have high insulin level. It's just that their cells don't recognize the insulin well. There's a disconnect. You make too much, but the cells don't use it properly. It's a dysfunctional insulin. So either the secretion could be low, quantity-wise, or the quality is not good enough that the cells cannot use it well. And the liver makes sugar in spite whether you eat or not. This many people don't understand. They think our energy comes only from food outside. Independent of your intake, the liver makes sugar. It's what keeps us functioning in the fasting state. So if the liver decides to make too much, it's again a problem. And the disconnect between the pancreas and the liver could be an issue too. If you're in a fed state, the liver should be quiet, saying, hey, somebody has fed me from outside, let me not make as much. But if it doesn't understand that and keeps producing it, there's a disconnect. You put it from outside, you're making it from inside, your sugar is high. Right? These are called ligands. Every organ in the abdominal cavity or anywhere in the body, they all communicate with each other through biochemicals called ligands. And if the communication system is lost, it's like independent, chaotic function. There is no one group leader. Each one doesn't talk to each other. I make my own, you put some more, and nobody knows how to get rid of it. The insulin is dysfunctional, So the liver, the muscle says, I cannot handle you. It sends it back to the blood, and the kidney says, kidney should filter it. If you have excess sugar, kidney should filter it, but the kidney says, oh, sugar is very important for me. Let me reabsorb it. See how the body can be so dysfunctional. And so what happens, everything adds up and your sugar goes higher and higher. So the muscle should take up the glucose as we function well, and if there is decreased glucose uptake because of the insulin not being very good, then also there is an issue. So this is called the terrible triad, the terrible three. Now we have the disharmonious quartet. It's like an orchestra where all the children have not practiced, and each one does their own tune, and the orchestra leader is as confused as the students. So this is what happens inside the system. This is the disharmonious quartet. Now we have added the fat. The fourth defect is the fat. So increased lipolysis, where the fat burns, that can be an issue too. Now we have the quintessential quintet. Now we have an orchestra of 5 people, more dysfunctional than the other 4. And so what happens is, your pancreas has decreased insulin secretion, your liver doesn't listen to anybody, just keeps on manufacturing sugar, your muscle does not take up the glucose because the insulin is defective, the fat keeps increased lipolysis, meaning destruction of the fat cells, releasing free fatty acid, and then the gut, I guess I'll have to wait for the gut to appear, decreased incretin effect. This is where modern medicine is coming close to the Eastern thought of Ayurveda. Initially, the disease of diabetes was thought to be mainly pancreas and liver and fat and muscle. Now we realize that the small bowel, a very magical organ, makes hormones called GLP-1 and GIP, which are called incretins, which are excellent. They are very, very good. The new drugs like Januvia, Byetta, Bidurion, Victoza, they all belong from this category. And these have weight loss effect, which is so much needed in this disease, dreaded disease of diabetes. And let me backtrack and say one more thing about the incretin effect. The way they realize the incretin is looking at the Gila monster of the desert of America, because the Gila monster eats only once a week or something like that. So scientists were intrigued. How can it eat once a week and survive? So they looked at its saliva, and the saliva has a chemical called GLP-1, which we also make in the small bowel, and diabetics tend to have less of this. And so my patients come and say, give me the injection that is the spit of the Gila monster. This is what one patient said. I said, what? Then I realized she was talking about this drug, thanks to the Google and the internet. So now we come to the septaceous sextet, the 6 defective orchestra, the 6th person, the dysfunctional person. And here, it's again the pancreas. It's 2 defects in the pancreas. Pancreas is a magical organ, very small, shaped like a fish behind your stomach, and it has the tail, and the tail, there are 2 sets of cells, the islet cells of Langerhans, the beta cells and the alpha cells. The beta cells make the insulin, the alpha cells make the glucagon. Glucagon raises sugar, and insulin lowers sugar. So if the islet alpha cells keep on making glucagon, then again there's an issue. The system already has too much insulin, but defective insulin. So the sugar is high anyway. So the body should realize if it functions in a homeostatic way, it will say, let me make less glucagon. Instead, this is a dysfunctional system. It makes more glucagon. So it's like one negative feeds on to another negative. So increased glucagon can be a problem too. And now the next defect is the kidney. The kidney has a threshold. Threshold is a number at which if your sugar reaches at or above that number, the kidney should filter the sugar and excrete it in the urine. Let's say it's 140, 120. But in diabetics, it tends to be higher, unfortunately. The system should realize, hey, sugar is very toxic to me. I have high sugar, so let me get rid of it through the urine. Instead of saying that, it raises the threshold and waits till the sugar becomes higher and higher to excrete it. So there was a drug that didn't get to the market yet, which would decrease the threshold of the kidney, so which would be good. No matter what the defect is, if the sugar reaches 140, then the kidney would automatically get rid of it. But that is another defect. It's increased glucose reabsorption. Instead of getting rid of it, it reabsorbs, thinking that sugar is energy, I need it, not knowing that sugar is doing more damage to me. So now we come to the ominous octet, the 8th defective person in the orchestra. Here, the brain. Finally, sugar is not just a disease of the pancreas or in the abdominal cavity. It all comes back to the yogic principle that the brain is somehow involved too. And let me come to that. The brain, hypothalamus, is a very small 3 to 5 millimeter organ right in the middle of your brain. If you draw a line between your ears and at the Agni Chakra, draw a line this way, right at that confluence of these two lines is the hypothalamus. And this organ secretes dopamine. And this dopamine should be at a certain number, higher number, in the early part of the day when we wake up. And so I will come back to the brain later because I really want to dwell on it. It's very important. Now we come back to details of these defects. The pancreatic defect, again, just like one bad thing leads to another, it's a negative vicious cycle. Higher blood sugars kill more beta cells. As if we didn't have enough in the fire, it's like adding more fuel to the fire. The sugar kills more beta cells, so the sugar goes up again and again. So the glucose is very toxic. Lipids or fats are very toxic. Amyloid, a deposition of glycoprotein, is very toxic. Incretin effect is low. Insulin resistance, insulin is plenty, but it cannot function. And genetics, chromosome number 6, if it is defective, you're more prone for diabetes. And age, relentless age. Each day we have an older cell than the day before. So again, I think this is again saying the same thing in a more pictorial way. So as it is loading, let me talk about the brain. The brain and the hypothalamus, it's fascinating. This new drug came into the market just maybe within a year. And for the last 29 years of practice, I've never written a prescription which says, take it within the first 2 hours of waking up. So this is a new experience for me because in the early morning hours in diabetics, apparently they have less dopamine effect. And because of that, their insulin becomes dysfunctional. They have more insulin resistance. So in the first 2 hours, if you take a drug that can work at the brain level and make the dopamine higher, then your insulin resistance becomes lower. So your insulin can function better. So again, I think that is the West coming very close to the Eastern philosophy that perhaps there is something more above the diaphragm. Let's not concentrate only below the diaphragm. There are many other structures above the diaphragm, a lot more powerful, that influence disease processes. So defects in the pancreas. Let's stay on this slide a little bit because amylin, many people don't know this. Amylin is a hormone that is secreted, co-secreted with the insulin. And amylin does all the good things. It makes your glucagon function appropriately. Like if your sugar is high, the glucagon should be low. And many diabetics have low level of amylin. Nowadays, you can get an injection of drugs that stimulate the amylin too. So amylin is deficient in diabetics. Okay, this slide is very important. Chronic sustained physiological hyperinsulinemia induces insulin resistance. What it means in layman's term is that suppose you secrete high insulin just for 3 days, for whatever reason, you're stressed, you're traveling, you ate too much, you're attending a wedding, whatever it is, you over-secreted insulin just for 3 days, your insulin does not function well. So you can imagine how many times we all have insulin resistance. We do travel, we do get stressed, we do attend weddings, we do eat heavy. So just 3 days of high insulin can make your insulin dysfunctional. So insulin sensitivity or insensitivity or resistance is not only in diabetics. It happens in people just with a little bit high triglycerides. It happens in hypertension. It happens in coronary artery disease. It happens in obese people. And it happens in anybody who comes to the hospital in an acute situation. A large variety of people coming into a hospital with anything acute, they probably are a little bit insulin insensitive at that time. And anyway, the liver is a fascinating organ, second only to the skin in size. And here, it makes its own sugar, independent of your eating. And if it autonomously functions, making too much sugar, there's a big issue. Then we come to the muscle. In the muscle, the sugar has to be taken up, oxidized, converted to energy, and anything in excess, since sugar is so toxic in the bloodstream, anything in excess has to be stored away as glycogen in the liver and the muscle. If the muscle does not do the storage properly, like if you have a pantry, if you brought some groceries, you'll keep something to cook. The excess goes into the pantry. If you don't put it in the pantry and leave it outside, that's an issue, right? Similarly, the excess sugar has to be stored in the muscle and the liver as glycogen, and if the muscle is defective, it does not do this process. So it sends it back to the bloodstream, again raising the sugar. So this proximal defects in the insulin signal transduction system, which means the insulin is like the doorman that lets the sugar into the muscle. So it has to be of the right quantity and quality to let it in. If the doorman is dysfunctional, he just decides, I'm not letting anybody in today. So no insulin enters the cell, so the sugar keeps circulating in the circulation, not being converted to energy. And this is the complex diagram of how the muscle and the insulin makes the sugar get into the muscle. Here we come back to the fat, obesity. Normal weight is less than 18 body mass index. Overweight is 25 to up to 30. Obesity is 30, and morbid obesity is 40. So we have, on the one hand, people starving, on the other hand, people just gorging. Here, Epicurean suicide. Food is a weapon of mass destruction. We don't need any nuclear bombs. People can kill each other with their own food. I'm reminded of a joke. One time, one of my German patients went to the hospital and she died in the ER with a massive MI. So I called the ER doctor at Clear Lake in Houston and asked him, what did she die of? He said Epicurean suicide. He stimulated me to make this slide. I said, what is that new disease, Epicurean suicide? He said she killed herself to death with food because she couldn't really stay awake from food even a second. She would eat all night long, not sleep, keep eating. She had a massive MI, a lady, one of the big blood vessels, and died. So that's where the term comes from. Lipolysis, Fat is a fascinating organ. There are two types of fat. One is brown fat and one is white fat. Apparently, humans have very little of brown fat, whereas hibernating animals like the bears have a lot of brown fat. So when they are hibernating and not taking any calories, they just burn the brown fat very effectively into energy and they can survive. Whereas we have white fat, apparently. There's not much known about it. There's also two different types of fat called the subcutaneous fat and the visceral or the abdominal fat. The subcutaneous fat is just a blubber. It makes us warm in the winter times, and when we fall, it prevents us from injuring the organ. It's like a layer that protects us. Whereas the visceral fat can be very metabolically active. It's like a hormone gland. It makes a lot of hormones. Like Shirley Tellis was telling us, it makes the good hormone leptin that makes us eat less. What a beauty of the body. Fat making something to reduce us to decrease appetite. So the body is very beautiful, and this, when the fat is burned, it releases something called free fatty acid and triglyceride. This free fatty acid is very toxic. When you get an ultrasound, if they say you have fatty liver, beware. People will say you have fatty liver, but many people have fatty liver. It's nothing to worry about. But fatty liver indicates that your insulin is not functioning well. All of us have a little bit of fat around pancreas, liver, and kidneys, but too much, and when it gets broken down, free fatty acid released, this free fatty acid kills all the beta cells. It causes a lot of destruction. So that is the active fat, Ravana. Bad person being very active is very bad. Whereas Kumbhakarna, inactive fat, fine. He can be bad, he can stay in the body, but as long as he's sleeping, he does no harm. So fat is very toxic. Fat equals inflammation. Fat causes a lot of inflammation. Fat is very toxic, the wrong fat. Okay, so now we come to the brain. So the hypothalamus responds to nutrients. We eat, it becomes sugar and fatty acids, and once we eat, then the hypothalamus should tell us, hey, you've had enough, don't eat anymore. But the hypothalamus doesn't give that signal because of this low dopamine in the morning hours. And so now we have a drug which does all the, it resets the hypothalamus to function normally so that the insulin can function normally. Yes, it's in the market. It's called Cycloset. Cycloset. It's bromocriptine is the chemical name. So alteration in the hypothalamic messages ultimately leads to dysfunctional high glucose and high free fatty acid and high triglycerides. And you can measure your free fatty acid also. When you get your panel done with your physicians, ask them to measure insulin, free fatty acid. These are very nice to get a peek into your cell. So dyslipidemia, as you can see, causes a lot of dysfunction. Okay, let's go fast. Yoga can just about affect all the 8 defects. The Ashtavakra Vyadhi has Ashtavakra prescription. It can, like a lock and key. It can fit in easily for everything. We may not have evidence to show that, yes, it makes the liver make less sugar, it makes the pancreas function better, it balances the glucagon, and it makes the gut make more incretin, it makes the muscle take up more cell, it makes the kidney filter sugar at a proper level, and it makes the brain make more dopamine. But exactly, it works at every level of the defect. So this is the complete prescription designed by Dr. Nagaratna and VYASA for diabetes, the yoga therapy for diabetes. And the only thing we caution is not to do yoga mudra. According to the study by Dr. Sahe, it showed that yoga mudra increased blood sugars for whatever reason. So, but you don't have to do all of them. I guess your yoga therapy and yourself can pick and choose according to your body type and convenience. So deep stretch and concentration on the zone of any organ for that matter, then just letting go causes deeper rest and better microcirculation, probably macro and micro. These are some of the organs, and at each level you can see how when you do yoga properly, you eat less, your satiety level goes up, and your hypothalamus functions better. Your dopamine is probably just very active in the morning when you need it. And at each level, and at the highest level, like Dr. Nagaratna was saying, at the Vijnanamaya Kosha and the Anandamaya Kosha, healing is constant. No matter whether you're age 90, whether you're age 1, healing is a divine, cellular, ingrained, because we want to survive. There are two things that are eternal, that life will go on, and each cell wants to repair itself as long as you don't have obstacles. All we are doing in all these therapies is to just remove the obstacles. It's like a sculpture. The murti of this Ganesha is already in that sculpture. It's just covered by excess material. When a sculptor just gets rid of, chips away all the unwanted things, the murti just comes out. He doesn't really create the murti. It's hidden inside, you don't see it. Similarly, the disease process too, you just chip away the obstacles. You make the insulin function better. You create a free pathway for the flow, then the magic happens. So these could be some of the newer research that we can take up. Does the incretins increase with yoga? Does the dopamine increase with yoga? And does the liver learn to make less sugar with yoga? And does the stomach emptying time increase? Because if the stomach just empties very quickly, like a dumping effect, when you eat, it should be slow. If it empties very quickly, then the insulin is not ready to address the sugar. So then there is an imbalance. I think I'm running out of time. Yeah. I think most of the other slides are very going over the same principles. So I would like for you to take home message is that even though diabetes is a very complex, multi-defected disease process, there is a perfect prescription for every defect, and deep understanding of all these defects, and like the stock and the glove, if you give the right prescription for the right defect, then prevention, cure is not a far-off dream. It can be a very easy realization today. Thank you.